So, you're having chest pain, but your doctor's told you it's not a heart problem. That can be, well, really confusing and frankly pretty scary. So, in this explainer, we're going to talk about what might really be going on and, most importantly, how we can start to find you some relief. Before we start, please remember that this explainer is for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always talk to your doctor or a qualified healthcare provider about any questions you have regarding your health. All right, let's get right into it. Anytime you feel pain in your chest, it's scary. I mean, where does your mind go? Straight to your heart, right? That's a totally normal reaction, and it's what almost everyone thinks. But I want to start with the most important thing I can tell you. That pain you're feeling, it is 100% real. It is not in your imagination. And the really good news here is that with this specific condition, it is not coming from your heart. Okay, so if it's not your heart, then what in the world is causing this pain? Let's peel back the layers and look at what's actually happening. So the official name for this is functional chest pain. But what does that mean? Really, you can just think of it as a communication problem. It's like the messages between your brain and your esophagus, your food tube, are getting their signals crossed. And because of that mix-up, the nerves in your chest they get way too sensitive. This whole thing boils down to something really powerful called the gut-brain connection. Picture this. It's like a super busy two-way highway of information that's running between your gut and your brain, all day, every single day. Now, with functional chest pain, it's almost like that highway has some crossed wires. Or, you know what, a better way to think about it might be like having a fire alarm that's just super sensitive. You know, the kind that goes off from a tiny bit of steam from the shower instead of an actual fire?
And this image here really shows that connection perfectly. See, normally your brain and your gut are in constant conversation, and everything's fine. But with this condition, something as simple and normal as food moving down your esophagus can get misinterpreted by the brain as a danger signal. And your brain's response to a danger signal? It creates the feeling of pain.
And this is a really key point, because the problem isn't actual damage or an injury. It's this signal mix-up. The usual painkillers you'd grab at the pharmacy often just don't do the trick. We need a totally different game plan, one that targets the miscommunication head-on. So what is that game plan? Let's get into it. We're going to start with step 1, looking at your daily habits. And you'll see these are some really simple, practical changes that can make a surprisingly big difference. First off, try eating smaller meals. This just helps keep your stomach from getting too full and putting pressure up on your chest. Next, after you eat, try to stay upright for an hour or two. Just sit or stand. Let gravity do some of the work for you. It's also a fantastic idea to become a bit of a food detective. Keep a little journal to see if you can spot any foods that might be setting off the pain. And finally, things like managing your weight can also help take some of that physical pressure off. So, what kind of triggers should you be on the lookout for? Well, here are a few of the usual suspects. Things like caffeine, alcohol, and really spicy or acidic foods. But remember, your journal is your best tool to figure out which of these, if any, are a problem for you. All right, let's move on to step 2. This is where we go a little deeper. This step is all about calming down those nerves and talking directly to that gut-brain connection we mentioned earlier. I love this idea of a magnifying glass because it's so true. Think about it. Stress and anxiety don't actually create the pain out of thin air, but what they can do is act just like a magnifying glass. They can take a small, kind of uncomfortable feeling and blow it up until it feels huge and really scary. So it makes sense that therapies that help calm your whole nervous system can make a huge difference. You've got things like cognitive behavioral therapy, or CBT for short, which helps you retrain how your brain responds to those pain signals. Even simple things like mindfulness or relaxation exercises can help switch your body out of that fight or flight mode. All of these are basically ways to turn down the volume on those false alarm bells. Now, for some people, those first 2 steps might not be quite enough to get the relief they need, and that is perfectly okay. That's where step 3 comes in, finding the right medication. And the goal here isn't to just numb everything out. It's really just to help turn down the volume on those overactive pain signals. Okay, this next part is so important. If your doctor ever suggests a certain kind of medicine, maybe something like a low-dose antidepressant, please hear this loud and clear. They are not saying the pain is all in your head. I know that's a common fear, but that's just not what these medications are for in this situation. What they're really doing is using them as something called neuromodulators. And the best way to think about that is
a volume knob. That's it. At very low doses, these medicines act just like a volume control, simply turning down the sensitivity of those hypersensitive pain nerves in your chest.
So, your doctor has a few different options they might consider. There are those nerve calmers, the neuromodulators we just talked about. They might also look at spasm relaxers, in case the muscles in your esophagus are squeezing a bit too hard. And sometimes they might even try acid reducers, because for some people, even a tiny, totally normal amount of acid can be enough to set off those super sensitive nerves.
Okay, so let's zoom out and put this all together. When you look at your path forward, I think the most powerful takeaway here is that you are in the driver's seat. You're not helpless, you have a plan, and you have options. Now look, this can be a chronic condition. All that means is that it can stick around for a while. You might have good days and bad days. But the main message, the thing all the research shows, is that this is highly, highly treatable.
Just by understanding what's really going on inside your body and by working with your doctor on this 3-step plan, you absolutely can quiet down those overactive nerves and get back to living your life more comfortably. Please remember, relief is possible. It really is.